Pleased to introduce Dr. Charles Rudin, who's going to discuss his abstract first-line pembrolizumab or placebo combined with etoposide and platinum for extensive-stage small cell lung cancer, the KEYNOTE-604 long-term follow-up results. As you all know, small cell is one of the types of cancer we haven't yet sort of cracked, and Dr. Rudin and his teams have spent a lot of time thinking about this. I'm excited to hear this longer-term study.
Great, thank you. This has been great. I've actually learned a lot already this morning. What do I do to put my slides up? Oh, there we go. Great. So I'm going to present this longer-term outcome of a study. There was a first-line trial for patients with extensive-stage small cell lung cancer. So this is a particularly grim cancer, as you've heard. This study looked at chemotherapy with or without an immunotherapy, the immunotherapy being pembrolizumab. Pembro has shown activity in small cell lung cancer in the recurrent disease setting, and this study was looking at it up front. The study was positive for progression-free survival. That is, the progression-free survival was better on the pembrolizumab arm with a hazard ratio of 0.75 and a p-value of 0.0023. However, it was actually negative for overall survival, although there was a pretty good hazard ratio of 0.8 in favor of the pembrolizumab arm with 95% confidence intervals that did not cross 1 and a p-value of 0.0164. This is an updated data set now with about 3.5 years of follow-up of these patients. And I think in part this is important because we can learn from these studies that are actually statistically negative but are informative for our patients if we continue to follow them. This is the study design. I won't belabor it. Happy to address those questions and a little bit about study disposition. Again, I won't belabor this further. There were 18 patients that completed the planned 2 years of pembrolizumab therapy, and we focus a little bit in the presentation on these 18 patients. I think the important take-home from this slide is really that we can't cull out these long-term benefiters by clinical parameters. Their age is the same as everybody else. You know, their split performance status exactly the same as everybody else. 3 of these patients had brain metastases at baseline. 3 of these patients had liver metastases at baseline. They really look clinically like everybody else. These are the updated survival curves now with most of the patients out past 3 years. Small cell lung cancer is a tough disease, and unfortunately, it remains quite lethal. But there is a tail on this curve, and there are real survivors out here past 3 years, particularly in the population that got pembrolizumab. And this is true really across the various subsets that we looked at, with the exception perhaps being patients who had brain metastases at baseline, although this is a very small cohort. Too small to really interpret. To me, this is the more important take-home slide here. This is progression-free survival. And again, these patients stopped therapy after 2 years. And you can see that on the control arm, there's essentially no long-term progression-free survival on chemotherapy. But the patients who got pembrolizumab, there is a significant tail on the curve here, and of course it's much lower than we would want it to be. It's in the single digits. But these are patients who are surviving long-term with extensive stage small cell lung cancer off therapy now for multiple years, living their best life and really off of therapy. And that's a real paradigm shift, I think, for us as oncologists. There's a 20-fold improvement here in 2-year progression-free survival. My colleague Mark Chris likes to look at overall survival and progression-free survival, and he says, on the survival curve, there's patients who are fighting 2nd and 3rd and 4th-line therapies and are in the hospice programs, and these patients who are remaining progression-free are really in a different class. They're not suffering relapses. That's important. This is a summary of the response data. The response data was actually published. The top part of this graph was previously published, but the duration of response data is new, and you can see again on the chemotherapy arm at the right, really very, very few patients remaining progression-free In contrast, on the pembrolizumab arm, 10%, remaining with a duration of response over 42 months. So these patients are really doing quite well. Small subset, but important. Adverse events were as expected. There are some adverse events associated with immunotherapy. We know that, but there was really no safety signal, new safety signal on this trial. And these are the 18 patients who comprise the tail of that curve. These are the 18 patients who completed a full 2 years of pembrolizumab. 14 of these 18 patients remain alive as of last assessment and are continuing to be followed. So that's the deal. So 3.5 years of follow-up now. The patients who are on pembrolizumab, I think, continue to show clinically meaningful improvements in particularly progression-free survival, which I think I would emphasize here, as well as overall survival. There's about a tripling of the 3-year overall survival rate, about a 20-fold improvement in 2-year progression-free survival. Safety profile not particularly remarkable. And those patients who completed a full 2 years of pembrolizumab have durable responses, with the majority, 14 out of 18, remaining alive, now with about 4 years of follow-up after randomization. So I think, we need to continue to explore the benefits of immunotherapy in this patient population and see if we can build on the tail of that curve to raise it up to apply to more of our patients. So thanks very much.